My name is Kristen, and I'm an administrative assistant in plastic surgery. This video will help answer the 10 most frequently asked questions about breast reduction surgery. Breasts that are excessively large in proportion to body size frequently lead to complaints of back, neck, and shoulder pain, difficulty in exercising, grooving from bra straps, and rashes beneath the breast. A breast reduction is a surgical procedure where a plastic surgeon will remove extra breast tissue and skin to alleviate the symptoms caused by large breasts. What does a breast reduction do? It makes the breast smaller. It lifts the breast. It makes the dark area around the nipples, called the areola, smaller. It's the surgery covered by my health insurance. Most insurance companies have criteria which can be found on their websites, but this is a commonly covered service depending on the specific insurance carrier. Of course, copayments and deductibles may be required, and you may be required to try other treatment options for your pain prior to being approved. Following your consultation, our office will submit the clinical information from your visit to your insurance company for pre-approval, if required. Our administrative staff is very experienced with insurance coverage for breast reductions and can help answer the questions you have throughout this process. Dr. Orgill will now give some more details about the surgery and recovery.
Does a breast reduction leave scars? Yes. Typically, there's a scar around the nipple and an anchor-shaped scar beneath the nipple. In some women, scars can be modified to eliminate either the vertical or horizontal scars, and these different techniques will be discussed with you at your consultation. It is not possible to do a breast reduction without scars, but they do tend to fade over time. In some cases, liposuction alone can be utilized, which greatly eliminates scarring. How much tissue is removed from my breast? We typically remove about half the volume of your breast. In many women, this turns out to be a decrease of about 2 cup sizes. For example, if you were a 38 triple D bra before surgery, you might expect to go down to a 38D bra after surgery. This is a good discussion point to have with your surgeon at the consultation, as there's some flexibility within this range. How long does a surgery take, and what is the recovery like? Surgery usually takes about 2 hours. During the procedure, you will be under general anesthesia and you will not be awake. We will watch you in the recovery area for about 4 hours after surgery, and if everything looks good, you will be sent home the same day. We will want you to get up and walk around frequently during your recovery, but recommend no active exercise for 2 weeks. We generally suggest being out of work for 2 weeks. However, patients with desk jobs can often go back after 1 week. How bad is the pain after surgery? Most women have less pain than expected after surgery. We use local anesthetics during your surgery and are careful with tissue manipulation to minimize the surgical pain you will have after the surgery. Most women find that they can manage the pain with Motrin and Tylenol once they go home. We can provide a small amount of narcotic pain medication following the operation, but we like to minimize this due to potential complications. What are the possible complications of breast reduction surgery? Scarring happens in all cases, but scars often fade over time and become difficult to see. Bleeding, infection, blood clots, and delayed wound healing can occur. Occasionally, some women note less sensation in their nipples. Rarely, a nipple could be completely lost following breast reduction due to inadequate blood flow to the tissue. What can I do to minimize the scars? Most women heal nicely after a breast reduction. If heavy scars do begin to develop, silicone sheeting and scar gels can be used. For heavier scars, steroids can be injected. Do you test the tissue that is removed? We send all tissue we remove to the pathology lab. They examine it and issue a report that comes back about 1 week after the surgery. You can see this in the test results in your medical records. We will go over these results with you when you come in for your follow-up visit, usually 1 week following surgery. We use dissolvable sutures during surgery, so no suture removal is required. Will my breast grow back? For women who have completed development, it is unusual to have the breast enlarged following breast reduction. Occasionally, women who become pregnant or gain weight may need a repeat reduction.
We hope this video has helped to answer some of the questions you have prior to your consultation, and we look forward to meeting you. Please contact your surgeon's office for any individual questions you have.